about osteopaths, about what it is, how it works, whether it is necessary to do this, charlatanism, harmful or not harmful, I decided to shoot this video in the form of such a video response, where I will try to tell all the pros and cons of this approach. The most vivid representatives of such techniques on Russian YouTube are Gastaprav from Ulyanovsk and Yuri Repin. They collect millions of views, a huge number of comments, and I constantly get some videos with their participation on messages. They evoke a dual feeling in patients. On the one hand, it is clear that the patient obviously feels better after such procedures, but on the other hand, it is understandable that such a level of intervention could potentially be dangerous. The first thing I would like to explain is how their methodology works. The thing is, very often back pain is caused by blockages in the vertebral motor segments. That is, it's a situation when the vertebrae start to move poorly relative to each other. This blockage most often occurs as a result of hypertonus of small muscles that control the vertebra and the facet joint. And there was a very interesting study conducted where in a small town lived a manual therapist and his wife, a pathologist named Anton. The manual therapist personally knew many people in this town. And when one of his patients died, literally within an hour and a half, his wife would call him, and accordingly he would check on the recently deceased person for those dysfunctions, those blocks in the spine, which he usually treated these people for. As a result of this research, it was proven that all blocks in the spine disappear instantly after death. Accordingly, this means that a block is not a hard subluxation that somehow fixes bone, but specifically a change in the muscle tone of small muscles. Most often, as a result of such a blockage, a pain syndrome arises in the area of the fascial joint, and it becomes difficult for the patient to move. A particularly common symptom is that it becomes painful for the patient to lean back, that is, to extend, because at this moment the facet joint should work, but this does not happen. Why doesn't this happen? Again, the most common variant is the blocking of additional movement that is in our spine. In fact, in all joints, there is so-called sliding and angular movement. That is, when one vertebra goes, for example, back, it not only deflects back, but also moves forward. That is, such a micro movement forward and deflection back occurs. For each angle of deflection back, there should be a slight sliding of the vertebra forward. The most common blockage occurs precisely in this movement of the vertebra forward. That's why you can see in various manual therapy techniques work on sort of pushing the vertebra towards the abdomen. For example, a person lies on their stomach and pressure is applied from above. In classical Russian manual therapy, you can often see sharp thrusting movements when there is a sharp pressure on the vertebrae. They improve mobility in this direction with a crunch, after which the pain passes and the movement improves. For example, in such a concept as the Maitland concept, this is the gold standard of manual therapy around the world. They perform what is called oscillatory action. I use it very often myself. That is, these are rhythmic pressures on either the longitudinal process of the vertebra or on the transverse process by pressing towards the disturbed curvature that is forward. Slowly, with varying force, there are 30 to 80 repetitions. We improve this mobility not by a sharp movement, but slowly. And because of this, the vertebrae start to slide forward well again. Many have seen such a technique for improving the mobility of the vertebrae, for example, manipulation in a roll. That is, when the patient is laid out in a twisted position and is sort of rolled over. What happens at this moment? The thing is that one of our facet joints has stopped opening. We can press on the vertebra, thus rocking it, opening it by pressing on the transverse process or the spinous process. But if we want to achieve the opening of this joint, we can also sort of twist the person. And as you can see, when twisting, the facet joint also opens up. Most often, if a sharp movement occurs, the fluid inside this little joint turns into a gaseous state. It opens sharply, and we can hear a click, which is usually also accompanied not only by sound, but also by a reflex relaxation of small muscles in several segments of the spine. That's why usually after a crack, there is a kind of relief in the spine and relaxation of muscles, improved mobility of the vertebrae. In other techniques, well, for example, in the world-famous Mackenzie technique for working with back pain, a self-mobilization approach is used. You could see in my videos all sorts of bends or the use of additional belts to sort of push the vertebrae forward during the bend. This is a self-improvement of the mobility of the vertebrae forward for the improvement of the bend, and improving the bend will provide improvement in movement in all other directions. Why exactly does the extension, that is the bend, improve? Because when we improve the bend, we will see improvements in all other movements of the spine. This is what's called the Fryette's law. He's a researcher in spinal biomechanics who talked about how improving the mobility of the spine in any direction leads to some improvement in mobility in all other directions of movement. And if we develop the most restricted movement, all other movements dramatically improve. That's why many techniques you'll see from body practitioners will be aimed at either tightening or moving the vertebrae forward. If we look at the techniques of Yuri Repin or Kostoprav from Ulyanovsk, we can see essentially the same action. That is, they find a blocked segment that doesn't move, palpate the musculature that is tightened as a result of the blockage on the vertebral motor segment, and accordingly the nerve is stimulated and the musculature is excited and they unblock this level, but they do it by striking, yes, but essentially the strike will do the same thing as, for example, oscillation. That is, well, such gentle pressures in the Maitland, only gentle pressures, they are much safer and they can be well dosed, yes, and do it quite painlessly without such a psychological shock for the patient. And with a striking action, this happens, let's say, more sharply and less controllably. Why do I like this technique? That is, it will definitely work. There are no questions about it. It will work especially well when we have a big, healthy young man with a strong block. Because when there is a strong blockage of the segment, it really takes a lot of force to unblock it. And possibly perform oscillations in this zone for 5 to 10 minutes. That is, it's very difficult to get the vertebra to move in the twist. And such heavily blocked zones will indeed unblock instantly with a strong enough impact, bringing instant relief to the patient. And this can be not just an instant effect, but also a lasting one. That is, this topic is absolutely workable. It's not a fake. There's no deception here at all. They really do help patients in this regard. What are the downsides? The first downside is the power of the effect, which is quite difficult to dose with such energetic movement. And here, patients with osteoporosis will suffer first and foremost. That is, if you have low bone density, then nothing will happen with light presses with the vertebra. If it's a shock or a blow, then a fracture of the bony process or the vertebrae or the transverse process can occur. That is, osteoporotic bone can break. This is the first problem. The second problem, microtraumatization of the ligaments and connective apparatus of the vertebrae may occur. We have all these muscles doubled by microligaments, and when we make a very powerful action, sharply increasing the amplitude of movement, we don't know how much we are increasing it. If it increases too much and sharply, you may get a stretch of the ligaments, a kind of micro tear, which will later manifest as a nagging pain after the session for quite a long time. Yeah, they even say themselves that there is some back pain for a while after this, that you need to take a break from the session. This happens due to the inflammatory microtraumatizing processes in the vertebrae, which can later heal with partial scarring of these ligaments and restore stiffness to the vertebral motor segments. The third point, it can be dangerous for patients with instability of the vertebrae. That is, when I looked at how they conduct the session, I don't really like the fact that they only work to improve the mobility of the vertebrae segments. That is, they basically take the idea that there must be a block, but very often we see that problems with back pain are not related to the fact that there is a blockage of the vertebrae, but with the fact that the vertebrae move too freely. This is the so-called instability of the vertebrae. It can be functional, that is, in principle, everything is fine, but the muscles hold the vertebrae. Such girls can be gutta percha, whose vertebrae seem to be shaking. And there is non-functional true instability associated with the so-called anterolisthesis. That is, when the vertebra has already moved from its place and is, for example, already in the forward position. And if a person has an anterolisthesis of the vertebra, yes, with its displacement forward, or for example with a retrolisthesis, that is, for example, you can often hear such a diagnosis as retrolisthesis. Since the description is always made in radiology according to the upper segment, that is, as if, for example, the fifth lumbar vertebra has moved back, but in fact it may be in place, and the sacrum has moved forward, as if it fell through a bit. And this will be called retrolisthesis L5. In fact, this will be a forward displacement of the vertebra. If we hit the base of the vertebrae hard, like they regularly do in their videos, we can get a sharp change in the position of the vertebrae or the lumbar spine, which leads to an instant stenosis, for example, a kick with two legs. I recently had a patient who attended a session with a manual therapist, not an osteopath, who also uses striking techniques. And he accordingly hit her in the fourth lumbar vertebra, which was in the position of antelisthesis. She had a straight leg numbness with loss of strength right at the session, and all this unfortunately ended with the fixation of these vertebrae with metal bolts surgically. Managed to restore the legs, everything went through, but imagine the person eventually went on a quite traumatic, serious operation. In this regard, it is necessary to first conduct a detailed testing, to talk to the patient for a long time, conduct testing, trial procedures to understand whether he needs to improve mobility in some moments, or vice versa. This segment should not be touched, but do stabilizing exercises that will give a good fixation with the muscular corset so that there are no problems with the amplification of instability. Because I often see such a situation when patients with instability, there are not so many of them, about 5%, they come to manual therapists, to osteopaths, even to osteopaths. And mainly people who work with their hands using these technologies, they start doing what they are used to, that is improving the mobility of bones, and this only leads to a deterioration of the condition. Therefore, usually if a person comes to me and says that I felt worse after manual therapy, osteopathy or osteopathy first of all, we will think about treatment with exercises, not manual therapy. Accordingly, if you think about it, then in principle, these methods have the right to exist. They are very often found in ethnic therapies, such as folk ones widespread in China, in Thailand, when there is quite a large flow of patients, and they don't even undress them. Quickly, literally in a couple of minutes, the healer sets up the situation. That is when patients, let's say, and healer patients cannot communicate for a long time or conduct some kind of treatment for a long time. And in general, more to some Chinese, less to others, there in general who got worse, who got better, not many people understand. Yes, there's just a crowd going and going. So in such a case, in principle, such therapy is justified. She will also be a better fit for young, strong people up to 45 years old without particularly severe problems with osteoporosis, with severe osteochondrosis, or with severe problems with joints. That is, such strong guys in principle withstand such technologies, and most likely it will be even better for them. That's it. Therefore, there are pros and cons. If you like this approach, you can try it. Most likely, I hope you won't have any major problems with this. If you think this technology is not suitable for you, then osteopathy and European American manual therapy and Nordic manual therapy will be softer options. Such technologies as Keltenborn, Mulligan, or Maitland. Look for therapists skilled in these therapy types. They are more clinically justified, help well, and are safer. Good health to everyone.